Hi, I'm Jeannie Di Bon, and welcome to this Junior Zebra event where we're going to be looking at deep breathing and other techniques to manage pain and anxiety. So I'm a movement therapist and Pilates teacher based in London and globally online. And I've been teaching since 2008, and I specialize in working with people, lots of children and teenagers as well, who have hypermobility and EDS. And the main reason they come to see me is typically because they have pain, they have joint pain or muscular pain. So today we're going to look at some techniques together to help us manage our pain and anxiety. So these are just some of the issues that might be familiar to you and you might be going through at the moment. So pain and migraines and subluxations, fainting, POTS, maybe digestive issues, coordination, difficulty playing sport at school or games, difficulty concentrating. You know, sitting for long periods at school can be really challenging when you're in pain, and obviously sleeping is often impacted when we're in pain or we're stressed or anxious. So these are all just, and then you could probably come up with even more issues that you have to deal with on a daily basis. So these are just some ideas that I had, but I'm, very aware that the anxiety that can arise with this condition and having to manage it on a daily basis can be really, really impactful. So we want to kind of look at some ways that we can help reduce our stress and our anxiety. Now, before we get into our little exercise that we're going to do together, I just wanted to give you some sort of daily posture tips. Now, feet awareness. What do I mean by that? So I don't know about you, but a lot of people have pronated feet or flat feet. So when our feet are pronated, it can cause all of the bones in the legs to roll in. So maybe your knees roll in, your thigh bones roll in, and it can then, once you get into that position, it switches off our glutes and it can make the pelvis tip forward, and that can give us backache, and then that can change the position of the shoulder. So just starting at the feet can have a huge impact on everything else in the body, which seems crazy. But once you can sort of sort out your feet alignment, and many of you may already have orthotics, which can be really, really helpful. And it's amazing, people put in their orthotics and their pain can decrease significantly once they start wearing orthotics. So training with the feet, in this photograph, I'm doing some heel raises, just lifting my heels up and down. That's going to start building strength in my feet and my ankles. So simple little exercises for the feet can be really, really important for building awareness of the feet. So when we're standing, we want to be really, really conscious of our feet so that we're not sort of hanging in our postures. Okay. Now, crossing legs or wrapping your legs around the other leg when you're sitting, they can be quite comfortable. Yes. Many of us do that. But I'm just going to suggest, if you can remember, try not to do the crossing of the legs or the wrapping of the legs. Okay, whenever you're sitting, or standing, because I used to wrap my legs around when I was standing as well. So when you're sitting, try and keep your feet firmly planted on the ground and try not to cross your legs. Okay, even though I know it is more comfortable, but the more you can get into the habit of not doing these things, the less stress you're going to put on your joints. And, wrapping the legs around or hanging off one hip when you're standing, again, if we stand kind of hitched on one hip, you're going to be stretching one side of the hip and tightening the other side of the hip, putting the pelvis out of alignment. And that's, again, going to put extra strain around the joints and the ligaments. Okay, so firmly planted feet on the ground when we're standing, so that the body is in the best alignment possible, is going to help daily stresses and strains. And then this W sitting, I don't know if any of you do that, when you kind of sit with your legs in a W, that really does impact the knees and the hips quite a lot. So try not to sit in a W state. And if you can do the party tricks, you know, like the splits, or, you know, some people can do all sorts of funny things with their shoulders, you know, popping their shoulders in and out and bending their thumbs back. And again, let's try not to do those things, even though, you know, we might be able to do it and it doesn't hurt. But over time, you are stressing those joints and you're making it more lax. So we don't really want to be doing party tricks if we can help it. Okay, locking knees. So very, very common. When we're standing, we hyperextend our knees and the knees lock back. Now, the problem with that, apart from putting wear and tear on the knee joint, as soon as you lock your knees, or any joint, not just your knees, as soon as you lock a joint, the muscles no longer have to work because you're kind of hanging off the joint. So my leg muscles, which I need to hold me up, are not having to work. So they're getting stretched and they're just sort of hanging out on the joint. Now, also, as soon as you lock your knees back, your pelvis tips forward. And again, that's going to put more stress and strain on the joints and ligaments. So we're going to try and keep our knees nice and soft. And overstretching. I know sometimes it feels really, really good to stretch because we feel tight. And so we go into these big stretches. But in my experience, stretching, like static stretching, where you push and push and push, isn't beneficial for us because, first of all, the joints will stretch before you even get to the muscle or the connective tissue, the fascia. So you'll be stretching the joint and then you can get pain afterwards. And much healthier to think about doing dynamic stretching, okay, where you gently move in and out of a stretch, but you're not holding it and hanging into it for any length of time. Okay, so these are just some daily tips that can start to take the stresses out of daily life, especially, you know, at school or college or university. So we want an upright, relaxed, balanced posture. Then we'll start to develop muscle tone and conditioning. So we really want to be able to stand with the least amount of muscular effort required to hold us up. So not holding ourselves up with the shoulders, not guarding and bracing our tummy muscles, not squeezing anything, just being able to hold ourselves up with the least amount of muscular effort. That will take away a lot of the fatigue that we feel as well. Okay, so a relaxed posture does not mean that the muscles let go and the body collapses. It's actually the opposite. So it does seem counterintuitive to talk about relaxation, but actually it's what we need, because a lot of times we're kind of holding a lot of tension in our body, which is stressful and fatiguing, and we don't know how to let that go. Okay, so being relaxed means the brain has figured out what it needs to maintain alignment with less energy. So you're using less strain on the body, okay? And it can be a great way to release the muscular and emotional tension from the body, which may have been held for a long time, which can be very, very tiring, okay? So when we do hold and brace or guard ourselves, it's really, really fatiguing. So if you suffer from fatigue, helping to find ways to relax and release that muscular tension can really, really help. So what can we do to help with the pain relief? So improving our proprioception and our coordination, reducing our range of movement, so not doing those party tricks, working on our stability, and finding an appropriate exercise program that works on stability, muscle tone, improves our motor control so that we can improve the health of our tissues. And then breathing and relaxation. Okay, so that's what we're going to look at now. We're going to look at how we can start this process and start releasing some of that muscular tension that can be very fatiguing and stressful. And just a little bit at the bottom, you know, little and often is the key to success. We don't have to go and do hours and hours at the gym or wherever we're exercising. Little and often will be good to start building that muscle tone. And if we improve the muscle tone through movement, we will feel less tired and less pain. But importantly, we want to do things that we like, we love, and have fun. So, you know, if you have a sport with friends, even better. The social element of it is very, very important for reducing stress. So we're going to do a little practice together, about 15 minutes, where we're going to learn to recognize when we're holding ourselves. So I call them holding patterns. So what I was talking about, holding our shoulders, maybe bracing, guarding, not realizing that we're actually holding muscular tension in our body. So we're going to learn how to release some of those patterns, recognize our breathing patterns. So many people have what are called breathing pattern disorders. So we're not breathing as efficiently or as effectively as we could be. And breathing pattern disorders can cause stress and anxiety as well. So I'm hoping this is a technique that will bring you instant relief to an anxious and busy mind. So if you're at school or if you're at home and you can't sleep at night, this could be something you could start to incorporate to help you release some of that tension and quieten down the mind. You don't need any equipment, so you can do it anytime, even on the school bus or on a train or wherever, sitting or lying down. And important that you feel comfortable and warm. So if you need to go grab a jumper or a blanket, or you want to get settled somewhere now before we start. So again, you can lie down or sit, whatever feels more comfortable for you. And we will get started. So I'll just give you a moment to get yourself settled. Now, you might want to close your eyes. I find that when I close my eyes, it helps me internalize a little bit more, helps me feel things a little bit more. If that's too much for you and too strong, and you don't want to close your eyes, of course, don't close your eyes. Don't do anything that doesn't feel right for you today, okay? All right, so let's get started. You don't have to look at me. You don't have to look at the screen. There aren't going to be any more slides. So you can just relax, settle in, and just listen to my voice. And I'm going to guide you through this little exercise right now. Okay. So with our eyes closed, whether you're sitting or lying, just want you to just take a breath. And I want you to sigh through your mouth. I want you to sigh it out. Okay, so we're going to take the breath in through our nose. If you can't breathe in through your nose, by the way, don't worry, breathe in through your mouth. Okay, so don't get stressed about that. So breathing in, and then we're just going to sigh, an audible sigh. You're going to let that go. And we're going to do that 2 more times. Very soft, very soft. So sometimes when we talk about breathing, people get really het up and they start over breathing. Okay, and they feel they have to do the breathing. We don't have to do the breathing. The breathing is going to do to us. So breathing happens to you. You don't have to do the breathing. Okay, so just let the breath come to you. Just like when you're asleep, you don't think about your breathing. It's happening anyway. Okay, so 1 more time, let the breath come to you. And just sigh it out. Now, sighing helps regulate the nervous system. So if you're having a particularly stressful day or you're in pain, a few sighs can help really calm things down. Okay, so it's a nice little tip to have in the back of your mind to just sigh a few times. Okay, so now you're just going to let your breath return to normal. Okay, whatever normal is for you. So you're not going to be sighing. You're just going to feel the breath coming into your body. And I want you to feel it. I want you to hear it. I want you to feel it. And I want you to notice where it goes. And then I want you to notice when it leaves. And we're all going to have different breathing rates, different breathing capacities. So don't worry. Just do this at your own time. Good. So I want you to allow the breath to become very quiet. So if there's someone sitting next to you, I want them to not be able to hear you breathing. So I want your breath to be very quiet, like a little feather brushing the inside of the lungs and brushing the inside of the lungs as you exhale. So it's very soft, very quiet, very gentle. Now, whether you're sitting or lying down, you might feel, some people can feel a little bit dizzy when they focus on their breath because you actually start to get more oxygen coming into the body. So just be mindful of that if you start to feel a little lightheaded. But what I want you to notice is that on the exhale, does the body feel a little bit heavier? Can you let your body soften into the chair or into your bed or onto the mat, wherever you happen to be? So with every out breath, can you feel maybe your shoulders melt a little bit away from your ears? Maybe your belly softens. Maybe your pelvis, your hips feel a little bit heavier. Maybe even your legs feel heavier. Now, when we start to feel that heaviness coming into the body, that already tells you that you're releasing muscular tension. Because the reason we feel lighter, maybe in our chair or lying down, is because the muscles are pulling the bones away from the floor, so we feel lighter. Now, if I allow my bones to become heavy, allow them to settle into the chair or into the floor, I know that some of that muscular tension has already let go. Now, if we think about areas where we typically hold tension, maybe the jaw, a lot of us clench our teeth. Maybe we have TMJ, instability, so we hold our jaw quite a lot. The chest muscles, the shoulder muscles might be coming in and lifted up towards our ears. A lot of us hold our tummy muscles and kind of use those as a support. Some people even try and hold their diaphragms as a support. The thigh muscles can be quite tight in a lot of people, the glutes, the calves. So we're just going to go through the body now and just do a little scan and see if we can invite those different areas to soften and become heavier so that they too can release muscular tension. Now, every single one of us will have a different pattern. We'll have different areas where we hold tension. So if you have somewhere else totally different where you hold tension, you can go ahead and do the same thing for that other area. So we're going to start with the head. And as I exhale, I'm going to let my tongue rest on the roof of my mouth. And I'm going to let my jaw soften. So just saying those words, can you soften your jaw? And feel the jaw is a little bit heavier, so it hangs from the skull. That is instantly going to start to soften the muscles around the jaw. Then we can soften our throat. And we come down to the chest. Now, as we exhale, let those shoulders feel like they're melting away from your ears. Can you feel the weightiness of your shoulder blades? The upper arm bones? Can you feel the width across your chest as your chest opens and you can maybe take in more air? So just notice if shoulders and necks are an area where you hold tension. Coming down to the belly. Can you soften your belly? That's quite hard because if you're used to gripping your tummy muscles, holding your diaphragm, it can be quite hard to let go. So allow your belly to soften and allow your hips to soften. So can you let your pelvis feel really heavy into the ground? So if my pelvis feels heavy, I know that I'm releasing tension around the whole circumference of my pelvis. So the hip flexors, the front of the quads, the glutes, the inner thighs, the pelvic floor, all areas where we can have issues. So see if you can let your pelvis settle into the ground. So if you've got your legs out straight, if you're lying down, the legs can roll out very slightly if that's comfortable. Again, that will allow the leg muscles to relax. And you might be feeling resistance because if you're used to holding yourself in a certain way, the body might not necessarily let go on this first instance. It might still be holding on. So little and often we practice. But the most important thing is that you're recognizing that you may be doing that, because it's only when we realize that we're holding tension that we can let it go. If this is the norm for you, you wouldn't have been aware that you were even doing it. So that's fine. We're just bringing attention to what we might be doing. So we've softened the thighs. We're going to soften our calves. When we're coming down to our feet, feet can hold an enormous amount of tension, especially if they're sort of pronated and they're having to work much harder. So can you just softly wiggle your toes and then just allow them to be quiet and let your feet soften. Even if you're wearing shoes, you can let your feet soften. And then just take a final scan from head to toe. See if there's anywhere else that we're still holding on, we're gripping. And you're just inviting your body. You're not forcing it, you're just drawing attention to habits. So remember, these are just habits. Holding patterns are just habits. The good thing about habits is you can break them by repetition. So little and often, every day, maybe when I'm going to sleep or before I start my day, or I'm stressed at school, I can just do a little scan and I can notice where I might be holding that tension. So allow yourself permission to let go. Feel the safety of the ground underneath you, that you do feel safe and supported. So notice the sensation now of your body. Maybe it feels a little bit heavier than when we first started. Maybe you're more aware of your body than when we first started. And see if your breath has become any quieter. Has it softened any more? How do I feel? Do I feel a little bit quieter? A little bit calmer? Maybe my mind, maybe those thoughts are a little bit quieter. You know, and you'll never stop thoughts popping into your head. That's, you know, virtually impossible. So don't worry if you get distracting thoughts popping into your head. Don't fight them. Just recognize them and then come back to the weightiness of your body and the quietness of your breath. And the more you practice, the quieter the mind will become. So if you have lots of thoughts that are upsetting or stressful or making you anxious, the more you practice something like this, the quieter the mind will become. Good. So we're going to start wiggling our fingers and toes. We're going to start becoming more aware of our physical body now. So coming back into the room, wherever you are, noticing your surroundings. So on your next out breath, just take a breath in. As you exhale, softly allow the eyes to open. If you had your eyes closed, come back into your room. Notice the colors, the lights, the sounds. Just stay there for a moment before you jump up and go back to watching the presentations and busy lives. So just give yourself a moment to come round. Give yourself a moment to recognize with your conscious mind how it feels to have a relaxed body. Because if I can remember how it feels, and feelings are the most important, I can access those feelings whenever I need them. So whenever I'm feeling stressed or I'm in pain, I can access these feelings. Okay, it's not something I have to learn. I just have to feel. And that's the key to helping us reduce the stress and the tension in our bodies. So if you've been lying down, please take your time before you come up, because you know the blood will have settled. So we don't want to jump up and get dizzy. So please take your time. And I hope you enjoyed that sort of deep breathing guided body scan to help release tension and holding patterns from the body. I'm Jeannie Di Bon. Those are my contact details if you want to look up my website, or email me if you have any questions. But thank you for taking the time to listen. And thank you again to the EDS Society for hosting me, and enjoy the rest of the conference.